Hi guys, John Adamson, the rehab and documentation guru. Today I'm going to tell you a tale of two patients. So a while back I made a video that I was having a bad juju day, just kidding around, and some people were concerned for my mental health and basically said in comments, good thing you were there. I had another bad juju day, and it was a good thing that I was there. So I'm going to tell you about both of them. Both of them involve blood pressure. Both of them involve a request for 911. But one, I went above his head in terms of his request to not go to 911, and the other one, I honored his request not to go 911. So just want to distinguish the two cases for you. The first one, as a patient, they're actually both about the same age, in their 60s. The first gentleman was recently in the hospital with diabetic ketoacidosis, which is a terrible condition, one of the forms of metabolic acidosis caused by abnormally high blood sugars. And anyway, without getting into the physiology of it, it's a particularly dangerous situation. He was hospitalized for it, and during this hospitalization, he was struggling with hypotension and sometimes very, very low blood pressures. On the start of care, he was noted by the nurse to be unstable in gait and needing to use a walker, which he refused to do. And he was also demonstrating some non-compliance related to his medicines. So that was when the nurse did the start of care. When I arrived today, he was again found to not be using his walker, and he almost lost his balance as I was coming in the door. He had to steady himself on some furniture, made it to a chair, and we proceeded to talk. One of the things that was clear about him was that he obviously is non-compliant. He's obviously not all together in terms of his cognitive status. I asked him some orientation questions, and it was clear he wasn't oriented to date. And his general safety awareness was diminished. He didn't have much self-awareness. While I was there, his wife, who is also disabled, along with her caregiver, who was a little bit too nosy into the patient's stuff, went out for a doctor's visit, and here he is by himself, alone. I saw them getting ready, and I said, so I'm planning to leave here in a little bit, or is anybody going to be back? No, he's going to be alone. Okay. Well, I took his blood pressure. His blood pressure was 68 over I couldn't tell. Whenever the diastolic is I couldn't tell, that's not a good sign. I couldn't tell where it trailed off, and a 68. And I asked him, are you feeling dizzy right now? No. I've occasionally had patients who, probably because they tolerate low blood pressure often, it doesn't faze them too badly, but he was having episodes of dizziness during the day. Obviously, when I walked in, was one such instance. And I checked both arms, both were running low, and he wasn't surprised by the number. He said, yeah, I've been running like that occasionally. And here he is by himself, not fully cognitively with it, and I'm about to walk out the door. And I said, and he was able to, though, give consent. And I said, sir, I want you to go to the hospital. And he said, no. And I told him why I thought it was a good idea, and he continued to refuse. So I got outside the house, and I called 911 anyway. Why? Because in my estimation, he was not cognitively capable of making a safe decision. Neither was it safe for him to be alone, and when the EMS got there, they had informed me that they had involved Adult Protective Services in the past related to the wife. So they were going to involve related to the husband, so that took something out of my hands. So he's clearly not safe for a home health anything. He should be 24-hour supervision. And apparently, this was another thing, and I think he was with it when he told me this. He said the caregiver for his wife asked him to come pick her up, so he drove out to get her, even though he had told her on the phone he was dizzy. And she said, oh, that's all right, you're just driving. The caregiver's not exactly 100% there. So clearly, he's, technically, you know, if you drive, you're not homebound, but I mean, this guy shouldn't be on the road. That's just crazy. You know, there's people you meet as patients when you're in home health, and they say, oh, yeah, right up to my hospitalization or when I was referred to you, I was driving, and you go, please, dear Lord, let me not be on the road with them because I can't imagine them behind the wheel. I've had a few of those, more than a few. So, anyway, that was number one. Second patient I go to, which was right afterwards. I'm just having a bad juju day. Another evaluation. I walk in, nice guy. He greets me at the door. He's got steady balance. Recently had a heart attack and a TIA. And we were talking about pain. And, you know, there's a good reason you ask the pain question every visit. He said, well, I'm not really feeling pain, but I'm feeling chest tightness. How long have you had the chest tightness? All day. And then we started talking about his symptoms related to his recent heart attack. He said, yeah, I was nauseous. And I said, have you had any nausea since getting home? He said, oh, yeah, I'm having it right now. And anyway, chest tightness, nausea, and dizziness right now. Take his blood pressure. It's in the 180s over high 80s. I said, sir, it appears that it would be a good idea for you to go to the hospital. I asked him if he had taken his blood pressure meds. He had taken his pressure meds yesterday, the full strength that he was discharged with, and his pressure bottomed into the 80s over 50s, and he said he got real weak. So that's dangerous. So he took a small dose today, what he was previously taking before the hospitalization, and it is high. So anyway, he didn't want to go, and he was respectful. He's like, I don't want to go. I'll think about it. So I said, okay, I've got to call your doctor, and I called his cardiology office. I called his primary office, and I asked them to call him. And lo and behold, the nurse from the primary did call him, and he still refused to go. And I explained to him, you know, what could happen. But I did not call 911 on him because, one, his wife was there, had heard everything I said, and two, he's cognitively with it. So he's not at an immediate risk, assuming his heart decides not to explode, assuming he doesn't have a heart attack or a stroke. But I explained to him that the risk for heart attack and stroke were high, given that he had recently had one, but I did not call 911. So there you have two cases, one of low blood pressure with a cognitively not so intact patient being left alone when he shouldn't. He's got to go to the hospital. Versus another guy who's cognitively intact, can rationalize the decision, and has somebody there with him, and that's going to be his call at that point. You may differ in your opinion with me, and if you do, I'd like you to leave a comment. As always, please like and subscribe if you get anything from my videos, because it helps the YouTube algorithm and gets my videos found on YouTube, and I put out this content in part to get subscribers, because I'm selfish like that. Anyway, I hope you're having a great day. Take care, and God bless.